Okay, I guess we are ready. So, hello everybody, and welcome to the second day of Youth Mental Health on the Spot, a conference organized by the Mental Health Working Group of AEGEE-Europe and aims to bring together young Europeans, youth associations, professionals, and policymakers. For the people that do not know us, you can follow us on our social media, on Facebook and Instagram, and find us on the official website of AEGEE-Europe, and also email us for future collaboration. For those that were not here yesterday, we have launched a crowdfunding because we are all volunteers, so we would be grateful if you would consider donating something to help us cover the expenses of this conference. So this is day 2, called Mental Health in Youth Associations. We designed this day because we want youth organizations to care about the mental health of their volunteers and to actively include the ones that suffer from it. And I'm going straight to today's program. So from 3 to 3:30, we will have an introduction by Desireé from Project Mint. Then for the next 2 hours, we will have our panel discussion with 6 youth associations. And later we will have a 30-minute break and we will proceed with a workshop given by Frisse Gedachtes. And last but not least, we will have today's reflection groups. So I'm giving straight the speech to Desireé. The floor is yours.
Yes, thank you. I will start sharing my screen. Can everyone see my screen? Is it okay? Okay, thank you. So hello everyone. My name is Desireé. Thank you for having me here, for giving me the opportunity to say something about MINT. Well, as you can see, MINT, it stands for Mental Health in Non-Formal Education and Training, and it's a project by AEGEE-Europe, which we started, well, a long time ago, but I will tell you a bit more later on about the project. First, a really short introduction about myself and who I am. So as I said, my name is Desireé Van Langen. I'm a member of a local branch of AEGEE in Amsterdam. I became a member a long time ago, and I've been active on the local level, so doing a lot of positions and functions in Amsterdam. And after that, I became also active on the European level within AEGEE. So I've been a member and a coordinator of the Youth Development Working Group a few years ago. The working group is not active anymore because it was part of the focus areas back then. And during my term as a coordinator, we started to have a topic of mental health within AEGEE. It was the first time this topic was introduced in our association, and we didn't know much about the topic back then. Well, at least I did not. And also, I am a trainer of AEGEE Academy. This is a pool of trainers from AEGEE. It's a separate organization, but we are providing trainings and sessions to all AEGEE members in the network. And besides this, I became interested in the topic of mental health. However, I'm not a psychologist or something like this myself. I have a bachelor's in health and life science and a master's in healthcare management. And currently I work as a policymaker at the Dutch Healthcare Authority. So it is related to health, but not really the topic of mental health. But still, I am really interested and motivated about the topic. Yes, so let's check. Yeah, so about MINT. As I said, MINT is a project, and in the beginning of 2019, we started writing a grant application for the European Youth Foundation. This is a fund which provides money and economic, economics, so money and educational resources. And it's a fund by the Council of Europe. And it provides funding to youth NGOs. They have to submit a program and a whole kind of project plan on what they are aiming to do, how, when, and so on. And we applied for an international activity, which means we were going to organize a training somewhere in Europe. And we also had to make sure there were people from different countries of Europe. And as I said, we started writing this grant. I wrote this grant together with Anna and Alexia, two other members of AEGEE. And a few months later on, we got the news that the grant was approved. So we got the funding, and then we started actually really planning Mint. This one. Yes, so what exactly is Mint? We wrote a grant to organize a training advanced trainers event. So we targeted around 20 trainers, which are providing trainings and sessions with non-formal education methods. And we originally planned the event to happen in April 2020. And also it was actually planned to happen in Estonia, in Tartu, in the city of Tartu. But as you can see, I crossed some words, but of course, COVID happened. So in the end, we organized Mint online 2 weeks ago. And it was really nice, but I will tell you a bit later about the content. And as I said, we targeted a pool of trainers. So it was a really specific target group because in a lot of associations, a lot of people are sharing knowledge, are trying to help each other, but they also normally, or like a lot of them, do have their own pool of trainers, which are providing sessions, workshops, and trainings to all the members of their association and their network. And in our case, we wanted to have active trainers who already got quite some experience regarding trainings and being a trainer. And the event was especially to target the topic of mental health. So I know this is a lot of text, but I will explain you a bit. So the activity was planned for 1 week, like a 1 week training event in Estonia, as I said. And the goal was to acquire a mental health perspective in their training work. So while being active in the field of youth work, a lot of people provide a lot of trainings and sessions, but now we wanted to introduce the topic of mental health. Well, what do we mean with a mental health perspective? It means being aware of people's needs, emotions, boundaries, health, and so on. So really everything what has to do with mental health, and also knowing how to act upon those needs and emotions. So being aware of it, but also being able to act upon it. And as a product, we are going to write guidelines. We will start this process in 1 or 2 weeks, which means we got a lot of input during the sessions of the event. And now we're going to write guidelines, which will be distributed among all youth NGOs in Europe and all kind of pool of trainers which we know of, to share what we have learned and to explain, give tips, and motivate people to really take mental health into account when doing volunteering work, but also especially when being a trainer and organizing training events. By the way, if there are any questions, just raise your hand, please. I don't know if I can see them, but of course, feel free to ask questions. Regarding Mint itself, there are 2 specific things which I wanted to point out, which were, in our opinion, when writing the grant, really, really important. The first one was the location. So normally when we are organizing events, especially in youth NGOs, we don't have a lot of funding or financial resources, and we just have to deal with what is available and what is possible. But we know also from literature that the environment is really important when learning new things. And especially the topic of mental health can be quite intense, of course. So therefore, we wanted to select a location which was like in the middle of the nature. So as you can see on the picture, this was actually going to be our event in case COVID did not happen. So it would have been a really big house in which there would be rooms with 2 beds per room, so only 2 people per room. We would have different kind of spaces, so you could also read a book or chill or things like this during the breaks and in the evenings. And it was outside of the city, which means there are no distractions and we could just be in our own bubble, let's say, if I can call it like that, to make sure the learning space would be optimal, and also to take breaks, have a walk, and enjoy nature in our free time. So that was one of the requirements. And also we put a lot of time and effort while writing the grant into the schedule and the content. So I don't know how experienced you are in attending or even organizing training events, but normally the training event starts at 9 in the morning, and if you're lucky, you will be done at 9 in the evening, or you will even have reflection groups or something else afterwards. So while designing this event, we also acknowledge that this would not be the ideal way of learning something. So we took a lot of care about the schedule and the timing to make sure there's enough time for breakfast, for lunch, but also in the evenings to have a lot of free time. Of course, you can hang out, play games, do whatever you want, but there should be enough space and especially the opportunity to chill, to relax, and to, let's say, enjoy yourselves in whatever kind of way you prefer. So we included 4 sessions during the day and then a reflection group. That was like the original plan. Here on the sheet, you can see our final program. And yeah, as I said, we had a long lunch break. So you would have enough time to eat, to go outside, to read a book, to do some sports or anything you wanted in order to be, well, let's say fresh and fruity again to join the afternoon sessions. And we also divided the training event into different parts. So first we, of course, had to get to know each other. And then we firstly talked about mental health. Because as you can imagine, even though we are all Europeans, if I may say so, it doesn't mean we have the same understanding of what is mental health. So what does it mean? What does it mean for you? What are your experiences? It differs for every kind of person, but also among countries. And during MINT, one participant mentioned, for example, that she's also active on an international level. So she also explained the fact, like, even though we have different views on mental health within Europe, can you imagine sharing the same definition or meaning with people from Asia or America? So I think that's always good to be aware of the fact that everyone sees mental health, can see mental health in a different view or perspective. So that was the first part of the training. Then we moved more onto the part of your own mental health. So what does it mean for you? What are emotions? How can communication affect your mental health or your well-being? Active listening was also part of it. So it was a lot more about mental health in your daily life, not so much about a specific disorder or how to tackle it, but more in general about mental health and also well-being. And then the third and last part of the training event, we focused on mental health of others. So how to deal with emotions of others or how to recognize needs from participants when being a trainer. And lastly, also how to take care of your own mental health while being a trainer. For me, for example, I've been a trainer in some events, and I'm, how to say, I always want to make the best out of it. but I'm also kind of perfectionist. So I'm never, not never, but hard to satisfy. And then it can happen that you are not taking care of yourself properly because you are like in the mindset of, we have to go on, it needs to be better, it needs to be quicker, it needs to be more. So it's also really good to reflect, to talk with your co-trainers about mental health. What does it mean? And that was like the last part of the training session. So how to include mental health as a trainer yourself. So that's something about the program in general. I myself joined the sessions as an organizer, but in some of them I also participated. And even though I wrote the grant, even though I knew the trainers, I knew the schedule, I knew everything, I also learned some things myself. So that was really nice and also kind of an eye-opener, because I think on this topic you can read a lot of books, you can watch a lot of videos and so on. But in the end, you learn most by sharing, by listening to each other, and then really trying to understand what is mental health. This training did not aim to be able to tackle mental health problems or disorders, but just being aware of them, and knowing what your role as a trainer could be or should be can already be a really big step forward. And as I said, with the guidelines, we also hope to share that knowledge within youth NGOs to make sure that this topic will be more included in everything we do. Because it's not like, okay, we will do one session about mental health. No, it's something we have to include in everything. So designing a training, addressing participants, the application form, the schedule. It's a lot of things which can influence well-being of yourself, but also of those of your participants. Yes, I think that's it for this part. Yes, so that's a bit quickly what is MINT. Also, I saw there are some participants who, like some people who participated in MINT are present in this conference. So if you would like to share something or maybe something you've learned, or if you have any questions, then please let me know, because I see we still have some time left. I talked a bit quicker than I thought I would be. So please let me know if you have questions, or if some of the participants would like to share something from MINT. I think I will stop sharing my screen. Yes, now everyone is back. So does any one of you have any questions or thoughts on what I just told you about the MINT projects?
Well, I can see anything, but for sure, MINT sounds like a very interesting project. So thank you very much for introducing MINT to us.
Hi, Eva, sorry, is it all right if I can ask a question?
Yeah, of course. Yes.
Sorry, I only just thought of the question just as you were starting to, as no one else did there. Hi, everyone. Hi, Desireé. Nice to see you again. Hope you're well. This, as we were in discussions, obviously in the early days of this work, and it's fantastic to see where it's going and how it's been going. It's absolutely brilliant, and something that you or Youth Mental Health are going to fully support and promote when you need it. Do you have, obviously this project has a certain amount of funding attached to it for a certain period of time. What are your maybe ambitions or goals for this work to go in the long term, I guess? Where do you see it going?
Yes, thank you for the question. That's a really good question to which I don't have the answer yet. As I said, we started the project in 2019 while writing the grant. Then the training event was supposed to happen last year in April, so it was kind of on the break, and well, it was moved and moved again. So for now, we are mostly focusing on the guideline process. So we have the trainers, some experts, and also some participants. from the Mint event who are going to write these guidelines with us together. And we hope to share them around June or July this year. And then it's kind of a question on what to do and how to proceed. We are not sure yet, because indeed the funding was just going to be for the training event itself and the guideline writing process. And then the funding is over. However, I'm super happy to see that AEGEE now has a focus area on mental health. So that might be a connection for the future, but it has not been discussed yet on how to proceed with this project. It might be ending, but I'm not sure. I don't hope so.
No problem. Thanks, Desireé.
Yes, you're welcome. I'm also reading the chat quickly. Andre, what do you mean with the follow-up meeting? If I may ask.
I mean, we're still jealous at the fact that we couldn't be at the location, you know that, so we have to figure something out.
No, I know. If it would be up to me, maybe we will apply for the grant again, and then next year we will still travel to Tartu in Estonia to the nice country house. I would love to, but let's see if that's possible or what can we do about it. Yes, for sure. Also, thank you for your comments, Veronica. I totally agree. And indeed, this is what we were trying to do. So not only about the training itself, but also about the whole environment, the learning space, the schedule, like trying to include everything. Also, one of the topics which was not discussed and not really present, but for example, food is super, super important. Normally it's like low budget kind of, I don't know what kind of food, it depends on the country, I would say, and the organizers, of course. But those are like, I would say, simple things to change, or at least to try to keep in mind. So if you have a specific amount of money, try not to cook as easy as possible, but try to include at least some vegetables or some fruits, or like easy changes might already have a lot of effects on your participants and your well-being. So that's something I would like also to mention again. Any other questions or just comments or thoughts or things how you see events are being organized in your own association? Not so much. Okay. Well, if there are any questions on, then, oh, sorry, Eva. Please let me know. I would be really happy to answer them or even help you or advise you or something like this. So yes, it would be really nice.
Yeah, I wanted to say that Desireé will be with us in the whole panel discussion. So if you want to ask her anything later, you always can. So we're moving to our panel discussion, and I have the first question for all of you. Can you please briefly introduce yourselves and your associations? As I said, we have representatives from six associations with us. So Desireé, do you want to start as you already did?
Well, I don't know what I should add, but really shortly, I'm Desireé again from the MINT project, which is an official AEGEE-Europe project. I don't know what else I should add to this.
Okay, I saw that we already have a question for you. So Lizzie-Anne is asking, did the process of filling the grant, building the project, give you new perspectives on what was needed on a mental health point of view for trainers?
Let me see. I'm not sure if I totally get the question, but let's say while writing the grant, we first were like, yes, we will do just this training event and this would be the goal. But later on, we included more and more and more of the points I just mentioned. So about the food, about the location, about the schedule. So we were also kind of building on our own knowledge, but also the knowledge of other trainers and also the experts which were already involved in the grant writing process. And then I also realized that the way we normally do organize events and trainings, it's not always the best way to do it, let's say, because we try to focus a lot on the content, try to have as many sessions as possible in an event or a training, but that's not really the best way to transfer knowledge. Sometimes, well, it's called less is more, but especially in this case, it would be good to make decisions on what is really important, then make a session about it, and the rest of the time make sure people can enjoy themselves and relax. And also for the view of trainers, I think it's a bit the same. Like the environment is important, the way you address participants, co-training together. That's also a really important point. So it's not like, how was your session? But first it should be like, hey, how are you doing? How are you feeling? Can I help you with anything? And then move on to the next point, which is more content-wise then, for example. Yes, just I hope this shortly answers your question.
Okay, thank you very much. So I'm inviting Thomas from Frisse Gedachtes to introduce yourself and your organization a little bit.
Thank you. I have to close the window. I live in Amsterdam, close to Schiphol, so but I'm one of the 3 initiators of Frisse Gedachtes. And Frisse Gedachtes is, how to explain it, sort of a student movement, and we offer several free services to students to help them with their mental health. And one of these services is an online chat platform. And students can go on the website and they can choose to who they want to talk. They're all the students that are trained by us. So that's one of the things that we offer. And we also offer sort of a walking system, which means that in every university of applied sciences and also university in the Netherlands, almost every thing, we offer the opportunity to students to sign up, and then we connect them for free to another student of the same university, and then they can go on a walk together. A lot of people like to do this. I think we now have 3,500 registrations already. And these are also students that we have already connected to each other. So that means that in principle, they already got the opportunity to walk together, and we have also so far got very positive responses to this.
Thank you very much. I'm sure you can do more on the workshop today. So I'm giving the speech to Nishta or Antonis, whoever wants to go first from BEST.
Nish, wanna go? I guess I will start. So hello, I'm Antonis. I'm studying mechanical engineering in Athens, and I'm here on behalf of BEST. I am one of the ambassadors of BEST, so I'm handling external relations. BEST is a student NGO, a European student NGO, with presence in 93 universities and 34 countries right now. All of our students are technology students, and we have a vision of empowering diversity, and we try to do that by developing students. So we have three core services: one regarding complementary education, one for career support, and one for educational involvement. yeah, so we try to be active and not only improve our students' education, but also we try to be there for them and support them in any steps they want to take, providing additional services. If I'm not mistaken, we're missing Nish in the call. She may have some troubles with her internet connection. I guess he'll be back soon.
Thank you, Antonis. It's okay. I think we can go on with the next association, which is ESN, represented by Tayana. The floor is yours.
Yeah, thank you very much. So I'm Tana. I'm the vice president of ESN International. I'm originally from Croatia, but I'm currently living in Brussels, and I'm mainly responsible for the human resources, training and development, governance, and membership management inside of the organization. ESN is active currently in 42 countries across Europe, and we have more than 500 member organizations on the local level. What we mainly do is we support the international and exchange students during their short-term and long-term mobility periods. Erasmus Plus program is something that we mainly work with. However, we also work with other mobility programs, including the programs for young people, so not just for students. Thank you.
Thank you very much, Diana. So we're moving to Johan from EFPSA.
Yes, thank you. Hello, everybody. I'm Johan. I'm from EFSA. EFSA stands for European Federation of Psychology Students Associations. So I'm studying psychology in Vienna. We have about 36 member organizations, which makes us reaching over 500,000 of psychology students in Europe. And our core goals are serving psychology students and contributing to society in improving psychology in general on a student level, but also linking professionals, academics, and students. My position in EFSA is being part of the training office. And I am here today also as part of a project that we started during this mandate, which is called the Band-Aid project, because we realized that there's a lot of stress and a lot of challenges, especially this year going on for our volunteers. So we created this project together with our human resources to create a space for our volunteers to share and to talk to each other, but in general also to find information support in stressful times and to find a balance. And hopefully this project will continue in the next years, not just that, that there's a space for them during this Corona times, but in general that volunteering is not just a stressful experience, but also a fulfilling one.
Thank you very much, Johan. So next one is IFMSA, represented by Mariona.
Yes. Hi, everyone. My name is Mariona Borrella Raza, and I'm a medical student from Barcelona in Spain. And today I'm here on behalf of the IFMSA, which stands for the International Federation of Medical Students Association, which is a global organization that represents over 1.3 million medical students around the world in 140 national member organizations. And my position within the IFMSA is Regional Director for Europe, where we have 48 national member organizations. And what we do basically, we have different areas that we work on. Those areas being medical education, human rights and peace, public health, sexual and reproductive health and rights. And also we work on research, and we have professional and research exchanges. And yeah, I'm very happy to be here. Last year in the region, unfortunately not this year, but we keep working on it. Mental health was a priority to work on. And yeah, as I said, even though it's not a priority, we consider it a very important and overarching concept that should be tackled at all times.
Thank you very much, Mariana. And last but not least, we have Laura here representing AEGEE.
Yes, thank you, Eva. So I'm Laura Miranda, currently the Mental Health Working Group Coordinator within AEGEE-Europe. So AEGEE is, well, we presented it yesterday, so you can check it on the live on Facebook, but just to briefly introduce it, I would say that it's a youth association that was originally founded in 1985 as a student organization, and it has evolved with time. And now we accept people from all the faculties and everywhere mainly. But we're based in Europe, and we aim for a diverse and democratic and borderless Europe mainly. So, well, every year we decide on an action agenda and decide on the topics that we want to focus. But all of these in the thematic part are focused on the focus areas that are decided every 3 years. And now we are being the first team to work on the mental health topic. And yeah, we're very happy about it.
Okay, thank you everyone for introducing yourselves. I will proceed with some questions we already have, but I won't ask any of you in person. So whoever is ready and wants to reply, you can just raise your hand and I will give you the speech. So can you describe us the situation on mental health within your association? Okay, Andonis?
I will begin since it's going to be the shorter one of all, I guess. We have been taking small steps towards the mental health of our volunteers. We have not initiated any way of keeping track or of understanding like up to the point how volunteers are working around their mental health, but we're trying to raise awareness step by step. And we have initiated a couple of projects also regarding the participants of our events. We had one last year called Participant Wellbeing, and now we're in the process of having the Safe People project. So we're taking steps slowly and steadily, but we're not there yet.
Thank you very much, Johan.
Yes, so when you sent us these questions, I was a bit confused, honestly, because it's often difficult to like quantify, okay, we are at this percentage of mental health awareness or something. But obviously, we are all psychology students in my organization, or just recently graduated psychologists, meaning mental health is a topic that is very big in our organization, and we are very aware of that. But we also realized this mandate that we have a higher dropout from positions, meaning people resigning than usual, which is definitely something that we also try to evaluate what is going on. In general, we have quite an open and safe, we build an open and safe environment, at least it is the goal in our working community. And we very much value that people always approach people in leadership positions if they're struggling, if they're in need of any help. And if they need any time, for example, that's always granted. We are trying to build an environment of no pressure, for example. At the same time, if someone realizes that, okay, this volunteering work is more of a negative experience than a positive experience, leaving the organization is no big thing. And with this realization that, okay, there's a lot of stress in general in everybody's life right now, and a lot of challenges. This is, for example, why we started the Band-Aid project. Not just because we could say, yeah, we're psychologists, we know what we're talking about, but it's way easier to care for others than to care for yourself. So that's why we said, okay, we need this project so that we as EFSA not just care about the students that we serve, but also that we care for the students that are the serving people as our volunteers.
Thank you very much. I saw Mariona and Desireé have raised their hands. I don't know who is first. I guess Mariona can go.
Okay, thank you. As Johan said, it's a bit difficult to determine the rate of awareness that we have, but I would say that over the last few years we've seen an increasing number of sessions and campaigns being conducted and delivered over all the general assemblies and regional meetings that we have had. We have a specific workshop, a 3-day workshop called Mental Health Essentials that has been conducted also, I think 2 or 3 times over the last years. So students in the IFMSA are demanding more capacity building opportunities on the topic and are conducting more activities on a national level as well. And moreover, what we're doing on an international level, or as the ones that are currently working in IFMSA, we also want to make sure that the fact that we are volunteering in this association is not a burden, but it maintains its positive impact in our lives, which right now, as we all know, with COVID and everything being online and so on, it's a bit more difficult. But that's why we keep implementing an initiative that we have, which is a mental health watch within all our teams, where depending on the team, they conduct it bi-monthly or monthly, and we try to have a specific set of questions that try to kind of determine the mental state where our bodies and colleagues are, and see how they're doing throughout the year, and not only use this data for at the end of the year try to propose some recommendations during the handover period, but as well, if anyone needs help, or we detect that anyone is in need of help, we try to do the best we can. And I just want to point out as well that for this system, we actually consulted our colleagues in EFPSA so that they could review it and make sure that we were actually providing something positive for our members.
Thank you, Mariona. Desireé?
Yes, thank you. So first I wanted to say that Johan and Mariona, I think your initiatives and your organizations are super cool. I didn't hear anything about those before, so thanks a lot for sharing. It's really nice. As for AEGEE, I think Laura can later on add things if I forgot to mention them. But as I said, like a few years ago, we didn't do anything about the topic of mental health. So it started with one also of those objectives, I mean, to raise awareness. I think that went pretty well, because now, not only as a result, but also because the interest grew within the association, we even now have our own focus area, so the own mental health working group, which is really cool. So I think we are starting to get there. It's a lot about raising awareness, making sure that people know what is mental health, and also just knowing that everyone has mental health themselves. It's a really big step forward within our organization. So I think step by step, it's getting better and better, but still a lot needs to be done, especially while being active also on a local level, but also on the European level. I've seen a lot of volunteers who enjoy being volunteer, but sometimes also suffer a lot, doing a lot of work in the weekends, in the nights, a lot of stress and pressure, because voluntary doesn't mean no obligations, which is true, of course. I mean, somehow we have to make rules, agreements, share expectations, but just making sure to have check-in sessions like, hey, how are you doing? How are you feeling? How is your life? How is your work? How is your studies? I think those are steps which are which have been taken already, like the check-in within project groups or working groups, but still a lot can or needs to be done, I think. Maybe Laura, I don't know if you want to add something, as you cannot raise your hand.
Yes, thank you. Well, I have the feeling that now that we have the focus area and the working groups and people dedicated especially to it, we can do improvements and really put on process on the table. But also I think there's a need for all of the association to make a step forward, because I know that this topic can get to be very uncomfortable sometimes, and it's difficult for people that never heard about the importance of it sorry, I'm a little bit nervous. I'm gonna breathe and move on. Okay, yeah. What I try to say is that I still see a lack of initiative from local groups and also from other bodies into trying to go deeper into this topic. So, I mean, it's not that much about having 7 people trying to do everything. This is about moving the spirit and the interest, and not only because this is something that is because of something that is interesting for us. It's because it's a topic that involves all of us. I mean, we cannot do anything without our mental health, even if we want to. I mean, how do you make an engineering competition or a summer course or a summer university or whatever? I mean, without being mentally healthy ourselves. And with that, I also want to put the focus a little bit more on the mental health of our own volunteers, because I have the feeling that sometimes we forget about that, and how the way we do volunteering in our associations affect our mental health, for good or for bad. I'm not saying it's all bad. I mean, it's also super nice to have motivation to do new things, to get to improve yourself, get to know other people that have the same interests and the same values that you have, and that's super positive for our mental health. But other times we just try to push ourselves so much, and I don't know if we all have the same expectations together with our group mates and everything, that I think that can lead to some situations that are not so good.
Thank you, Laura. And I also see a hand by Diana.
Yeah, thank you. So in ESN, we started paying more attention to mental health when we increased the number of activities for students on the topic of mental health. So when the volunteers themselves became more aware and more educated about the topic, they also started caring more about it within the organization. And I think the first thing that started improving was how we did events. So we had also a lot of statutory events where we had a lot of frontal presentations and plenary time, and we started managing the agendas better so that we do not end at like 8 or 9, but that we end 5 to 6 at the most. We started also cooperating quite a lot on with like local producers who produce a lot of organic food, so that the food during the events is more healthier, since this is also connected to the energy levels that the participants feel. And we do have a team inside of the organization that always takes care of the implementation of physical well-being activities inside of the event, so that they have morning runs, that they have meditation sessions, yoga sessions during the event, so that the breaks are not just used for coffee and similar, but that the participants can choose to actually be physically active after sitting for several hours. It is also very much reflected into training. So if we have a lot of personal development trainings, we do make sure that we include a lot of me time in the agenda, so that the participants can actually distance themselves. We do include quite a lot of mentorship, so that participants have support from the mentors in this regard as well. And of course, we try to find the venues that are very much disconnected from the city, from the hustle, that are in the nature, so that the participants can really remove themselves from everything. And not have other worries, because when you are in the city, you probably cannot disconnect from your university or office, similar things that remind you of your everyday environment. We also have quite a lot of workshops, especially for trainers. However, when it comes to the volunteers, it's been quite slower, because we haven't been for a long time sure on how to actually tackle it. Then we did a few surveys. So we have a census inside of the organization that goes out every 2 years to the volunteers. And this was indicated as one of the issues, but mainly in relation to burnout, them not being able to disconnect from the work that the organization does and invest their free time in some other hobbies, as well as not being able to prioritize. So for example, either their tasks in the organization suffering or other things in their personal life suffering. So these are the 3 things that we have been mainly doing with the volunteers themselves. We have just applied for a project, so hopefully next year we will also be able to tackle it in a more structured manner and provide more support in well, through funding activities as well.
Okay, thank you. I can see a hand by one of our participants, but I guess we will leave some space and time after the questions for your. Thank you. Okay, so I'm moving to the next question, which is, do you think volunteering has a positive or a negative effect on your mental health? And apart from the projects that you create for your volunteers, do you think that mental health is discussed on your association, that people take it seriously, or is it still seen as just a dip? Again, whoever is ready can raise their hand. Okay, Antonis?
All right. I guess my personal viewpoint on everything in life is a bit gray. You know, there's no white or black. So I think this part is also gray. You have positive stuff, you know, when organizing an event, when seeing your work coming into a deliverable and into completion, you know, you get this sense of accomplishment, which helps a lot, and it raises morale. It provides a lot of I don't know. I'm not a medical student, but I guess a lot of serotonin. I mean, you're happier. You're alive again. But also, you know, you have all this stress, productive or not, during the preparations, that you have to follow a deadline, you need to do certain tasks. And to tell you the truth, the environment helps a lot. If you're in an environment where there is a lot of understanding that whatever you're doing is volunteering, and you're not obliged to do anything, as you're not obliged to do anything in life, to tell you the truth, other than survive, I guess. As long as there's that understanding, then everything can get a little bit more positive, but there's always going to be a threat for the negative side. Yeah, so I guess that's the answer for the first question. And then how we discuss mental health. it's a topic that is getting a lot more popular generally in the world right now, and so it is in every student NGO. I don't think we have made organized attempts at discussing mental health, but it is a common discussion inside the organization, inside working teams, and how everyone is feeling. The coordinators of projects are invited to pay more attention on how their team is doing and how they're feeling during their mandate. And yeah, we're trying to be more aware of it and be less ignorant about what certain words and certain attitudes may cause to the dynamics of a team and to each person and their actual health. And yeah, I guess regarding participants as well for events, we have had for a long time now some guidelines and rules on how to organize events. And some of those rules are to protect the well-being of the participants. And we've added even more. Since last year, we did a survey and we found some very interesting stuff about how people view the well-being of participants and what more we need to do. So we created some additional guidelines last year on how local groups should organize events better so that they pay more attention to the people that are enjoying our services. So I'll put a full stop here so everyone else can have a chance to talk. Thank you.
Thank you. I think Lara was next.
Thank you, Eva. Well, how to say this? I think that even though we're talking more and more about it, I think we're not going to the root of the problem. I mean, I have the feeling that we are talking about it very superficially. Like, of course, mental health is also feelings, is also yoga and movement and these kind of things, but it's also feeling exhausted. It's also mood swings. It's also fights that don't come to place, and obsession and burnout. And I think we don't really get to talk about deep problems that, I mean, I don't think any volunteering experience can really cause a mental health problem, but it can contribute to it, and it can be decisive. Or at least it has been for me. I mean, I've been volunteering for already more than 8 years, and I've been deep down in depression and other things that I'm not going to mention. So I have the experience in myself that it can really be an impactful situation to be volunteering and to give your heart to an association. So this is something that I want to work on more in the months that we have left, but I think it's also something that we should all think about in other associations as well. Because I don't know if it happens in all of the associations present, maybe you can tell me later, but I've seen a lot in AEGEE that after a board year in which a lot of things were going on, or after a position with a lot of responsibilities, maybe a leadership position, people just disappear from the association after that. And when you try to talk again with that person, it's like, I'm disintoxicating myself. So I've heard that comment, and why is it that we have the feeling that we have been intoxicated within our volunteering work? I mean, something is going really badly if some people are making these kind of comments. And I'm not saying that every team is bad and that everything, no, it's just that if this is happening, maybe it's more a structural thing, because I don't believe it's about the people. I don't believe people are just hurting each other because why not? I mean, it's not the purpose of what we do, but definitely if there are these kind of consequences, then there should be a root of the problem that we're not looking at. And also, I don't have a fine solution for it. I mean, I think we only can start talking about it and trying to maybe make a research with an association. Maybe we can start an investigation or something like that. I mean, it sounds super, I don't know, police work, but I don't know, when something is really going on, this brings me the project that we have within AEGEE called the Gender Watch, in which we can measure how people are being discriminated because based on their gender, and maybe we can do I don't know, some kind of project to try to measure somehow. I cannot know the tools yet because they're not developed, but maybe that's something that we can do, trying to develop some tools to really measure how the way we work is impacting the mental health of our volunteers. But can you tell me how is this in your associations too? So maybe we can try to look something together.
Thank you, Laura. I think Johan is the next one.
Yes, thank you, Eva. And also thank you, Laura, just to pick up your point. I love the idea to kind of measure that. While you mentioned board and leadership position people, I just quickly try to think about it, and I cannot give you a definitive answer about our association. I just know, for example, my coordinator of the training office is very, very exhausted after our mandate, and she wants to take a step back. But in general, I would say people are more following up also another mandate in our association, but I am very up for kind of measuring this, making the project. So I love the idea. And just to go back to the original questions, I would say, Antonis, it's not black and white. It doesn't always be positive or negative. But I would say it's positive in general, but volunteering can become a negative experience if you overwork yourself, or if you just in general have one negative experience. I mean, what we realized, for example, this mandate is that people, when they don't have an excuse not to work, they work for the volunteering work. When they just also maybe should relax, watch a movie, do something for themselves, for their mental health, because it's like not that you have office hours, but maybe it makes sense to implement then for your volunteering work as well, that you say, okay, I only work until 6 p.m., but then it's my time, and then it's my time to take care of myself, to take a bubble bath, to drink a beer, to, I don't know, just relax, because you need that for yourself as well, and especially for your mental health. And again, mental health is a topic that is very, very, very big in our association. We work on it for ourselves, but also for the people that we serve, the psychology students all around Europe. For example, what we have kind of similar to the project now Laura proposed, we have the evaluations from our human resources responsible that do check up on the volunteers regularly. And with every meeting, it is a small thing, but it has a lot of impact. Every meeting that any team has, we start first talking about how we are, what we are doing, what's going on with each other. And this is not just like, yeah, I'm good, and we move on, but it mostly takes a lot of time of the meeting, just talking about how we are, what's going on. And it's a very, very open conversation at the beginning of every meeting. And we also try to close the meetings in a similar way. So it starts with very easy and small things like implementing that in every meeting to check up what's going on and how people are. But then, as I said, we have evaluations from human resources. We have a lot of training sessions on that as well that tackle mental health and the volunteering work in general. So mental health is a big, big topic in our association, of course, because we also want to bring it to the general society, that people are more aware, and that you not just take a break when your leg is broken, but you also take a break when you are just mentally exhausted. And now I've also talked a lot, but again, Laura, I love the idea. Let's pick up on that.
Thank you very much, Johan. And I'm giving the speech to Mariona.
Yeah, thank you. I also want to echo Johan, and I think that it's a very good idea what was mentioned by Laura. Excuse my dog, he's barking a bit now. And what we are trying to do right now, we are having internal conversations within our organization, more about the working culture that we have, as you guys always also said, and also about the structure of our organizations. So this is, for example, our expectations. These are our goals and the things that we want to achieve. And we are trying to look into our structure and see if, oh my God, sorry about my dog. And we're trying to see if the structure that we have, if all the people that we have working on this is actually optimal for what we want to achieve, if we have enough people or not, because some of the things that we have been seeing is that people are overworked. So we need to really look into our structure as organization and see if it's enough, if it needs remodeling, or what needs to happen for next generations not to be suffering burnout more than once during the term, because as many of you mentioned, after a term in, we call it the team of officials within IFMSA, there's lots of people that also try to take a step back or take some time for themselves, or even during the term, just because it's a huge amount of workload and it can cause a lot of stress. So this is the conversation that we're trying to start right now, that for on the one hand, it's very important to raise awareness, but we also need to take action and try to prevent future situations like this.
Thank you, Mariana. And Diana?
Yeah, thank you. Well, I think that volunteering as a concept in itself, or any type of a community engagement, in theory is a very positive thing. And unless you really do have some sort of mental health issues that are not connected to the activity you do, it should generally be a positive experience that you have as a young person. But as we get involved in these organizations, we get passionate about them very easily, because I think that the opportunities we get as maybe leaders in youth organizations is something that people usually don't get until they find themselves in senior positions on companies. And we get immersed in this experience, and we don't really know how to handle it the best way possible. And we overstep our boundaries, so to say, and we give too much of ourselves for the cause. But a lot of that is also, I think, consequence of other structural problems that we have in the society, such that, for example, we don't have a lot of funding sources, right? So we do a lot of activities that are zero cost activities, and they do require more work. We do a lot of activities without grant or other resources, and they do require more work and therefore more involvement. So they also contribute to the more deteriorating mental health. So I think when we were talking about mental health in ESN, we were also discussing what does mental health actually mean to us, and what is the problems that we can solve as an organization. Because maybe there are some organizations that indeed do deal with the topic directly. We do not. This is simply a consequence that affects our volunteers, but we do not have enough experience in order to actually speak about the topic or assist someone without potentially harming them in return, because we are not experts in it. So we started thinking a lot, what does it even mean? And by having various surveys, we did realize that there are a lot of things that we can do that you wouldn't necessarily associate to mental health, but that does contribute to the mental well-being of people. For example, having a very centralized or decentralized communication, having a complicated or not complicated structure of the organization. So everything that is very organizational and that volunteers need to invest themselves in, is something that we can simplify and something that we can do better in order not to well, contribute to their mental health issues. But what we also should be doing more is that even though sometimes for us it feels that we can solve everything as youth organizations, unfortunately we cannot do it ourselves. And we do need to advocate for example, more access to mental health support of young people at universities, in municipalities, having hotlines that are accessible, not just to locals, even to international communities, so that these services are accessible in English, for example. So I think that we also need to divide what we can do and how we can tackle mental health and what we can organizationally improve and what we need a bit of an assistance from the outside world in order to actually tackle it. But I think that generally for people, it is much more easy nowadays to talk about mental health because we have been working a lot towards destigmatizing it, and that people do understand, at least the people we are surrounded with. This is again not the majority of the population. We are very much surrounded by open-minded young people who meet a lot of other people and meet a lot of different experiences, is that they do not necessarily associate it anymore with mental illnesses, but that they understand that mental health can mean mental well-being that can be associated to different emotional and social factors that affect your life. So I think that it's becoming more and more easily to talk about it, but doing something about it, we still, I think, face so many structural issues in the society in order to actually to be able to act outside of the organization and to make a larger change.
Thank you, Diana. I couldn't agree more personally. So I think next one is Laura.
Yes, I would like to subscribe everything you said. Also, well, okay. It also reminded me on how the introduction speaker of yesterday. I mean, he's Ramon Nogueras. He's an Spanish psychologist, and well, he mainly what he tried to put on the table is that mental health problems are more societal problems than health by itself. Like, it's not an individual issue, it's a societal issue. So I can see that within our associations, how they are structured, a lot of them have the same structure as a business has. And sometimes we just start, I mean, okay, I don't want to overgeneralize because I don't know all of the associations, but in the ones I've volunteered, all of them have something in common. And it's that we work like if we were a business with goals, objectives, and putting all our effort and all our hearts into getting them, but being volunteers and having our side work or our side studies and many other things. So maybe it's just how we are structuring them. Maybe they shouldn't be like businesses, or maybe we should have more secretariat hired in leadership positions, or maybe we need more outside support in some other things, because not everything can be done by volunteers, and there are some things that have so much value that they should be paid. I mean, just because the effort that it requires is so much that you cannot afford to have a job, a normal current job, and then doing that, because that's exhausting. So if you're putting your mental health in risk, is it worth it? I don't know. I might be a bit hypocritical about this because I'm the first one that I'm doing that. But how can I avoid it? I mean, I've been teach since I was a kid that productivity was the top one thing that I should be. Productive, a productive human in the society, because otherwise you're just a piece of meat with no value. So, and this is one of the premises of our society that we should fight against. I mean, this is not the values that we want to bring forward with the Human Rights Declaration and all of these things that sound so pretty, but then in the end we end up not doing it at all. So I don't know. I really don't know how to proceed with this, but surely I think that we at least need to rethink how we do things within youth associations, and which are the things that we want to keep and the things that we want to change, and have this conversation really, and being okay, again. I don't know, being eager to change. I mean, changes, especially big changes, can be very confronting and may raise a lot of questions, and we cannot make big changes just out of a sudden, because this is not also good for our mental health or for anything. But small changes, being step by step towards a direction that we decided previously based on what we want to achieve, I think is something that should be always present in associations. Some of us are still in the 80s in some of our, maybe not the 80s, maybe the 2000s, but still, I mean, it's 2021. So yeah, I don't know. I think there are many things that we can rethink how we do them. And I believe that we are always trying to do things so fast. And so at the moment, and not reflecting that much about how we do things, we're so focused on the what and trying to achieve results and trying to move forward without really having looked back at what we have already done and reflect and feedback each other and grow from that. So maybe being a bit slower is not that bad.
Thank you, Laura. And Desireé was next.
Yes, thank you. I also wanted to say that I agreed a lot on what you just said, Diana, and also for you, Laura, that there's a lot to think about and also small steps and things we can do. Like, for example, from my personal experience, when I joined AEGEE, at first you were like, okay, you have to learn and then move into positions step by step. So, for example, really looking up to people who were way more experienced, who were doing 10 projects at the same time. It was kind of something, well, not I wanted to achieve, but something I was looking up to. But it's not really the right mindset, I would say. Of course, it's good to learn things step by step, not to become a board member or a project manager directly. Like, of course, I do agree that also for your mental health, it's better to do it step by step. But those are things we can already start working on, that when people are joining, we can already kind of make sure they know, like not to promote doing 10 things at the same time, just step by step, one by one. It's a really good and important thing to do. And I had another point which I forgot, but when I will remember it, I will share it in the chat, I think.
It's okay. Thank you very much. And Diana?
Yeah, I just wanted to say that I very much agree that youth organizations are structured in a very ambitious way. What we did recently is we hired an external company to review our entire structure, and we changed it accordingly. So we can professionalize more on the international and national level in order to actually protect the local participation, which is the majority of the organization. And if someone suffers, they suffer the most. But what I wanted to say is that, again, like I said, I think that a lot of youth issues is solved by youth organizations. If we look at our policies in national frameworks, for example, educational policies are present in every country because education is usually somehow regulated by law, right? But youth policies are not mandatory. Youth policies are often not tackled by politicians, they're not tackled by governments. And even if you have some youth structures and youth bodies, they are often not handled seriously or not taken seriously. And therefore, a lot of issues that actually do relate to youth are expected from us to handle by ourselves. And this is why we also want to contribute so much, because we know that we are contributing to ourselves as well. So it's a kind of this give and take relationship that we are kind of thinking that we are also investing into our own future, which is in one hand true, but I think that mental health, like many other things, is a balance. So while I can see that many things in the organization can be improved, for example, if I decide to do a sprint and write a grant in 5 days, this might do very bad things to my mental health. However, if I get satisfaction from it because I learn now how to write a grant, or because I had this positive experience, it can also balance each other out. So I think that the conversations that we had with our local volunteers is mainly what are the things that take away from your mental health, and do things that you get actually substitute it. So for example, is the volunteering well recognized? Do I feel appreciated in the community? Do I feel appreciated in the organization? Can I see sense in what I'm doing? Because like I said, I think it's really a balance that we need to achieve, and everything in life that we do can take away from us, but it also fills us. And as long as that there's a balance between these two things, I think that we are doing something right. I still think that there are a lot more things that can be done, but if we are able to maintain that balance, I think that is already a work done quite well in youth organizations.
Thank you. I can see Desireé and Lara's hands. Have you raised again, or is it okay? So, we have a hand from Adonis.
Yeah, if I may add something, because I have quite a different opinion on some things that were mentioned. I think the organizationally wise, especially when you're an organization that is not aiming to tackle the mental health of all organizations and to be the one that gets to improve this for all other organizations. When you look inside your own structure, the best thing you have to do is build the environment where people understand it's not only this. You don't only have this, you have other things you were doing before and you enjoyed. So take some time and do these as well. And I wanted to link it with something else, sorry. That basically, I don't believe that anything you do in volunteering is, I do a task which is by default taking away energy and mental health from me, but then I feel the accomplishment, so I'm replenishing it. I think that having a goal, having that goal in mind while you're doing that, and your state of mind while you're doing that is the most important thing. Like you have your mindset before you start doing that, because you could be sad and you could be eating your favorite food, but you could be still doing it sad, you know, because you had that mental state before. So I do not think that however good that food is makes you enjoy it more. I think you need to do the preparation and to be ready and in a state where you can be productive and you want to do this. Otherwise, it doesn't make sense to volunteer. Do something so that you are better, and then you can do something more for others as well. That's all.
Okay, thank you. Right now we had planned to make a small break for about 10 minutes. We can meet again at 4:40 for the audience questions or anything else. So see you in 10 minutes. Okay, welcome back. I hope everyone's here. I have a last question for all of you, and then we can jump to the audience questions. So, yeah, my last question is how did your association reacted to the effect of the corona crisis had on the mental health of your members? And whoever is ready. Laura?
Hi. Yes, so I can share a bit how AEGEE managed it. I think that in general, there was a very good reaction from the members and from the locals. There were a lot of good initiatives like AEGEE in Quarantine group in Facebook, in which there were a lot of activities proposed, so everyone could go through it together. But I have the feeling that all of this energy went a little bit down after some months. And then now I would say that we are all so tired of everything and we don't want to do anything else online. And somehow I have the feeling that our weaknesses, let's say, are more visible now. I mean, because okay, I need a picture to explain this, because I have the feeling that, you know how if you try to navigate a sea or something with water and you don't know if there are I don't know, rocks or something behind it, like I don't know if this is hola. Yeah, this is me not preparing anything. It's bad. Well, whatever. You can imagine that. So if this is the river and here you're having some rocks, but the level of the water is high, you don't notice the rocks. But then when there's something problematic and the water goes down, then you can see the rocks and clash with them. So this is what I think that has happened with the pandemic. So we had weaknesses before that were covered by some other strengths that we had, like being able to travel, being able to organize live events and bond together with friends and these kind of things that we are more limited right now. So all the weaknesses, like I don't know, lack of coordination in the European spheres, or maybe lack of participation of some locals, or maybe that some locals don't really understand what are the core values of AEGEE and dedicate themselves to other things that are not that much AEGEE. So these kind of weaknesses that we had previously in the association, now they're doing more and more harm, just because we are lacking the good parts that were covering them back then, like before the pandemic. And I think now these weaknesses that we were able to overcome before the pandemic are really hurting our association more deeply. And this is why I don't know, I think that we really need to stop and reflect on what is going on. I mean, I'm not going to repeat myself because I already commented on this before, but yeah, this is what the pandemic has shown me, and how I understand the process that AEGEE has been through in this last year.
Thank you. I don't know who was first. Antonis?
Thank you. I guess it's the same thing. All right, so I can tell you the best has been trying to cope with it. Unfortunately, not that successfully. We tried to create a lot of platforms and to create game nights and be there for each other and to support each other, but as many of you may have noticed, it's a completely different thing. It's another life online, and it cannot replace what you were doing before, and you cannot transfer everything online. So in countries like Greece, where we still are closed in our houses, like by the law, we cannot meet for any reason. It's so tough to still be motivated and keep pushing for anything. And this had an effect of many people resigning from positions throughout the year, or just saying, I'm tired. I wanted to do this, but not anymore. I need something different. I need some kind of change. And people cannot change anything in their lives because they're stuck in between four walls. So what we've been trying to do is mostly giving people more breaks, room to breathe, asking them what they want. It's their own right to not tell us, but then we cannot do anything about it. You just leave them space and leave them be. And yeah, just trying to cope with how we're feeling first. I'm gonna go again to the previous statement that I made. Take care of yourself and show other people that they also need to take care of themselves before starting anything, because especially if you're a person that's leading a group or anything similar, you are transferring your energy to the other members. Therefore, if you're looking pressured and stressed, other people are going to think, okay, pressure and stress is what I feel as well. If you are calm and you're looking like it, then you can also potentially help other people feel better as well. So, yep, I think that on our end, that's everything we've been doing. So now, Johan, thank you for giving your turn, and I guess it's your time.
Johan? Yeah, I think we had technical problems, so Tayana may go.
Thank you. For us, it really started, I think everyone was feeling this adrenaline rush, and everyone was in the beginning very much working in full force. However, when everything started sinking in, we did experience low engagement in specific aspects, especially since the rules and the regulations externally were also quite confusing, and different countries were changing from one week to another, and we didn't know really what's happening. So it was also very hard to manage the organization and normal activities during times like that. We were also afraid to cancel a lot of things in case things improve, but also we were aware that we cannot have them physically at the moment. So I think that this quite contributed to the demotivation of volunteers, and especially their engagement. And since we are very much dependent on the number of international students, mobility is being cancelled, also quite a lot contributed to their image of what they're going to even be working on if they stay involved in the organization. I think that what helped a lot is when we actively cancelled all physical activities for the upcoming year, where we explicitly said that they're not going to be happening, and then people stopped hoping for them. So we didn't keep them in this loop where they hoped to have them, and they slowly started adjusting. We also now have some volunteers who do not know how it is to be a volunteer outside of the pandemic. So we're also kind of getting a new generation of people who are not necessarily adjusting, but who are now living in this world. And I think it is important to be working with them, because futures of our organizations very much depend on it, to be able to recruit and to keep those people, properly onboard them. But indeed, volunteers who were before active physical interaction, events, and similar things were their main motivational factor. And for them, knowing how it was before, it is very hard to give them something else that is going to replace that feeling of meeting people from all over the world in one place and spending 4 days with them and becoming best friends and whatnot. I think that this is not a feeling that we can replace, and this is not something that we can give them in return. I believe that we are going to be completely fine. Like I said, we are trying really hard to professionalize a lot on the international and national levels in order to support the local volunteers. So we did not experience any harsh consequences. We even managed to employ 3 more people during the pandemic. So we haven't really been harmed that much. And I would even say that in the eyes of the stakeholders, our reputation did increase because of the support that students received immediately, that universities, for example, simply would not provide. So the international relations office are not going to, pack the clothes of people in dorms and send it back to them to their countries, but our volunteers will. So things that were necessary and that then students gave feedback, universities took in and showed gratitude to our local organizations, which I think then contributed also to their satisfaction, because external recognition is also something that very much motivates them, knowing that they're doing something for their community. So in the end, I believe that we're going to be completely fine. And like I said, the volunteers are adjusting pretty much to the situation.
Thank you. Yeah, now we can have Johan.
Yes, so I dropped out. My internet took a break, so I hope I didn't miss anything. We are still in the question how we handled it, right? It's still the same question. That's basically the reason why I'm here. We started the Band-Aid project because we realized there's a need for it during the evaluations from the human resources responsible, which basically just emphasizes again the awareness on mental well-being, mental health. We didn't achieve everything that we hoped for. That's why I really hope that the project continues. But the ideas was basically approaching via 3 different ways. One being creating a platform for our volunteers where they can share, discuss, talk about either their volunteering experience, but also personal matters, their concerns, their well-being. The second one being training sessions, for example, for stress management, mindfulness, or other topics that just relate to the big topic of mental health. And to provide them with tools and skills, but also just bringing them together. And the third one being, and this is something that is really important just for the future, would be creating infographics, something that volunteers get at the beginning, some form of like a handbook on the topic of volunteering and well-being. Something that we unfortunately did not manage to do because as the team that formed for the project, we also at some point got exhausted trying to build that up because we realized it was too big of a challenge of what we created for ourselves. So what we did was similar to what Antoine said, that we created social evenings, we created training sessions for our volunteers, and because for a long time, like physical events couldn't happen. We as EFSA managed to pull off 2 physical events with no confirmed COVID cases, no one who got COVID. So what was really important for me as training office, we managed to have one event for first TNT, basically pandemic TNT, which we did offline in Bursa, Turkey, which high security measurements, let's say. And we managed to get a new trainers generation. And there was also a meetup of some of our work community, but unfortunately not everyone could meet, which was a big problem because like all of you said, physical events is really important when you volunteer on an international level, and not having them and not people being able to meet their co-workers from this generation is difficult. So that's why we created this project, and hopefully it will continue in the next years, because you cannot always meet, and we need this awareness, and we need people to have something already before they struggle and not just intervene when they are struggling.
Thank you. I can see any other hands there. So we can proceed with questions from the audience to the speakers, or even the speakers can make questions on each other, whatever you prefer. I remember that we had a hand earlier from Stella. I don't know if you still want to comment on anything. Yep.
Yeah, sure. So hi, my name's Stella. I'm from BVMD, which is the German partner from IFMSA. So I'm a medical student in 3rd year and in the board of BVMD. And I think it's really interesting to see how all the youth organizations are facing similar like difficulties and challenges. And we have also taken a few steps that we've adopted from IFMSA, and we're also trying to build our own. And one thing we have done within our organization, which is not mental health focused, of course, but is we build a task force for mental health for within the organizations and also for our members. So to address the topic, to do advocacy on the topic, and also to build a stronger mental health within the organization. And we have faced very similar challenges, like people from like former people in the board dropping out, disappearing into nowhere, but also like people from the current board. One person dropped out because she said it was mentally too challenging, and I think that's really sad. And we're also trying to take every single step, but unfortunately it's not enough. And it's really nice to hear what you're all doing, like also in your events, like what we do is snoozer rooms, so you can always, like, if the event is too much, you can just step into the room, take a blanket, take a nap, and just chill out, something like that. I really enjoy that personally. And things like that, and yeah, just talk about it. And I think that's also the first step, I think, towards it. And it's really nice being here and hearing everything and sharing. Thanks.
Thank you, Stella. Does anyone else want to make any question to our speakers? You can write on the chat, or you can open your camera and your microphone and tell us as well. Is it a hand, Nick? Yep.
Yes, it is. Hi, everyone. I guess I have a question, and I'm keen to hear from each of the speakers about this. I'm a director and lead at Euro Youth Mental Health, and I've worked in youth mental health, supporting young people for over 15 years. And I think something about volunteer, it's been really, really interesting hearing the different levels of engagement that you're managing and how you're trying, looking to support the people that are volunteering. As a volunteer myself, Euro Youth, it does, and someone mentioned earlier, you get so passionate about things. It's kind of like, if you have a spare moment, you're kind of like, oh, what can I do what else can I do? I've got this spare 30 minutes, as opposed to going, I should probably just go and read a book for 30 minutes and chill out. So it's been really interesting to hear other people doing the same thing. But I guess my question to you is, so I think it's really interesting. We did a piece of work with the Council of Europe 2 years ago, looking at mental health as a disability issue. Now, on recruitment forms for jobs, and depending on your own personal volunteer like sign-up forms, you might ask, the question, do you class yourself to have a disability? Now, we know that most people don't class mental health problems necessarily as a disability sometimes, or the terminology is a bit confusing, but mental ill health is a disability. But often we don't necessarily connect with that terminology, and some people would put, no, I don't. I'm just curious what your organization, if anything, what do you do when recruiting volunteers, what processes do you maybe have in place to try and give potential volunteers the opportunity to say, what support needs they have, because that's kind of something, just a simple way of putting it, isn't it? What support they might need in relation to anything, but also covering mental health. And just to give an example of what I mean by that, I have a young person who, it's quite a simple thing. Some young people I work with who get can get quite anxious in crowds or in the digital age, being on camera and talking on camera in this sort of on the spot way that we are now. You can't hide in the corner of the room. Yeah, and so they might be like, oh, sometimes I'll just disappear out the room, but they'll tell me, it's fine, I'll come back. Or if I'm not back in 5-10 minutes, if someone could come and maybe try and see if I'm doing okay. Yeah, there may be enough, and I'm just curious kind of what, if those sorts of conversations are had with volunteers before they, get going with yourselves. And so that's open to any speakers. You don't have to answer it, just if anyone's got any comments or thoughts on that.
Yes, Antonio?
Okay. For me, this has been a very hot topic the past 2 weeks at least. Maybe the one that is up front right now. I'm giving most of my time on and thought on this one because of the difficult times. And I'm going to answer on my side because not everyone in the organization is going to do the same things that I am. And I'm trying to understand how people could be feeling right now, because we're in a situation where if someone has anything at all, they just close their camera and you don't know what's happening behind the camera. They could be crying, they could be laughing out loud, they could be I don't know, hurting themselves, they could be doing literally anything, and you're not aware of it because you don't have that contact. And it's even more difficult. And I mean, you get to the point where you say, okay, maybe it's a little bit pushy and too much. I'm going to ask them. If they want to tell me, they do. And I think that's I realized recently that is the only way to go around it in general. You ask people, and if they want to be supported, if they want to be helped by you, then it's good. If they don't, you may not be the hero they need. They might want to open up to someone else, and you need to understand it, and you need to give them space so that they do their own thing. I mean, not everyone is supposed to do everything. So I guess understanding and putting yourself in their shoes in a similar situation is one of the most important things you can do for everyone. Even if they're like 3 years in the association and they know how everything is working, and let's say they've gotten used to it because it's something that you get used to even if it's wrong, you still need to treat them like it's their first day and you know nothing about them, because you might actually know nothing about them. Everything they might have shared up to now could be completely different from their actual truth and how they're feeling. So yeah, being cautious in general and understanding.
Thank you. I'm not sure who's next. Diana?
Yeah, thank you very much. So when it comes to the recruitment on the local level, there's not much that they can do, or there's not much they ask when recruiting volunteers. They mainly do not ask for data because, well, like I said, there's not really a lot that they could do. So they do not know how to support, right? If someone does tell them that they have any mental health issues, there's nothing that they can actually do with the data because they're not trained to support volunteers who have mental health issues. These are kids of 19, 20 years old who are just learning about ways of the world, and many of them would not know how to help or support someone. What they do ask about disability, and this is mainly administrative part, to see if they can actually accommodate this person in the office, because some of them have offices in buildings without elevators and so on. So they do ask about physical disabilities, visual impairment and similar things, but they do not really focus on mental health. When it comes to other activities, we do focus. So for example, for events, when we have international events, we do ask about things like this. And we do specify in the registration form the mental health. We do also accessibility. We ask them to provide one support person at the event and back home who we could call if something like this happens. So someone they feel comfortable with. And what we implement are sort of like security points. And this is something that we are now doing during online events as well, is if someone is feeling uncomfortable, if they're experiencing any issue during an event, they know that there's one person that they can approach who can help them and assist them in whatever it is bothering them. However, what we usually then do, if we from the registration form see that we are having someone who is experiencing a certain type of disability, we either really try to find someone in the organization who is studying something that they actually have practical and theoretical knowledge in how to support this person, or we try to find an external, which has been mainly done for physical events. So the organization committee usually finds an organization in the community that deals on this specific topic. So if we have a person who is really visually impaired, we ask them for support on how to support this person during the event. So this is something we do, but for the recruitment, not really.
Thank you. And I guess the next one was Desireé.
Yes, thank you. So I cannot, well, like I've been active on a local level like a few years ago, so I'm not sure what to say about their current recruitment strategy and what they ask or not. But from the trainer's perspective, for example, for our pool of trainers, when you apply, it's a really general form which you have to fill in. It's not really asking, as far as I remember, about physical or mental disabilities. I also see Alejandra nodding, so yes, then I'm correct. So they don't ask for those kind of things. Also, for example, for applying for a position or in the board of the pool of trainers like the academy, it's not one of the questions which is asked. However, for example, during my board term in Asia Academy, we had a really extended get to know each other. And then we had an activity which is called, I have to check, River of Life, which was kind of sharing your river of life. So everything you experienced or went through your life. Well, it's already explanatory. But it's only in a really, really small group with people you will be working together with for a whole term, like a year normally, those kind of things. So I think things are discussed or asked, but you're not obliged to share, or you're just sharing whatever you want. So it's not registered or anything like this. And for Mint, we had an application form which was quite extended with a lot of questions. But also one of the questions was really open, like, is there something you would like to share with the trainers? And then also explaining it could be anything. So it could be like, oh, this is a nice form, thank you. But there were also some people who were sharing more personal stuff. So I think it's really important to have an open question. Of course, you're not sure if people get the point that you're kind of asking for disabilities or mental health issues. But in general, people kind of sense what they are willing to share, and they are sharing if they want to do so. So I think it's like, personally, I would not go for a question like, do you have any mental health disorders? Because it's really explicit, really specific, and it's not really inviting people to share something, but having a more open question would work better, in my opinion. And that's also what we experienced when organizing minutes.
Okay, we can move on to Laura.
I'll try to be brief because we're a bit running out of time. But okay, regarding to the discrimination of people with disabilities, in the topic of mental health, I have not a clear opinion, because on one hand, I can see that if you're like very, very severely affected, then I really understand that that person would like to step out and not want to, and we should understand that if that person, it's not that maybe that they don't want to, it's maybe that they just cannot, because they cannot afford it right now. So this is something that we should obviously respect and let that person decide. But on the other hand, I also know from my experience that sometimes volunteering is the only thing that brings you willing to live or excitement or something that you are really passionate about. And when you don't want to do anything else because you're just sick of university, you have problems with your friends, you have problems with your family, and you just need something to stick to, then volunteering can be that. So I also think that somehow we should also give some space to those people to also have something that they can contribute to, because also for this can be also used like, I mean, not treatment by itself, of course not, but a kind of a complement to the therapy, because it can help you to realize that you're still capable of doing things. So sometimes when you're super shitty on your mental health, to say it somehow, you just feel like you're useless. So if somebody's giving you the opportunity to actually prove that you're not, and to prove that you can belong to something and you can contribute to something, maybe we should think on how to make it for them to have a safe space to actually being able to do it. Because okay, I'm not using nice words anymore because I'm running out of time. Okay, so if somebody with a shitty mental health wants to do something, I think we should prepare a space for that person to actually do it, but also given the flexibility that when that person says, okay, I know I compromised to this, but I'm not able to do it because I had a mental breakdown yesterday and I'm not capable of doing it, then we should be accepting that. And knowing beforehand that that person has mental health issues, then we should have a plan B, not to freak out and these kind of things. So somehow, keeping that in mind and preparing ourselves for giving that person the opportunity without compromising more their mental health, because if they feel like they owe them and it's being more and more pressure on them, then no. So how can we balance this, and how can we really build these safe spaces for people with mental health problems to be included in our volunteering spheres without even compromising more their mental health? I know this might sound complicated, but let's try. Okay, that was just one thing, because there's also, there were comments about feelings and what to ask and what amount of information we know about the other people. And yes, of course, I mean, if this is the life of a person, you might know this part. So we should never assume when asking. But at the same time, asking general open questions, as Desireé mentioned before, I think it's a good start. And if we want to know specific questions, specific things like how can we support you with your mental health in this event? So maybe that person has a coping mechanism based on exercise, or maybe that person has a coping mechanism based on other things, or on cooking, maybe. I mean, cooking helps me a lot to manage my anxiety. So if in an event I just had a little bit access to the cooking room or to the kitchen, that will help me a lot. And people don't know this because people don't ask, what are your coping mechanisms? I know this is a very weird question to ask, at least right now, because people don't have this awareness and such. and also the last point that I wanted to make, and I will shut up, I promise, is that we should also step back from being the savior of somebody. If somebody doesn't want to be helped, please respect that boundaries as well, because sometimes we believe, I mean, and I've done this myself and I regret it. I mean, I made a mistake that was trying to help a person who never asked for my help. So this savior complex that we sometimes have when we had problems before and we believe that we are able to empathize with everyone, wait, maybe that person is just not in the moment or not in the mood, or you're not the right person in a way. So yeah, my final point as well.
Thank you very much, Laura. And last one was Johan.
Yes, thank you, Nick, for your question. I'm going to be short as well. I've never done recruitment for EFSA myself, but remembering the process, we do not ask questions like that when recruiting for the working community. But I remember it being asked when recruiting for events, specifically, like it's similar to dietary preferences. You know, we need to be aware of that. If someone is to eat vegan, they should get vegan food. If someone cannot walk upstairs, there should be something so that they can avoid stairs. And if someone, for example, has general anxiety disorder, we should also be aware of that so we can maybe do the environment for this person. But for the recruitment, for the volunteering, and this is now my personal opinion, now I'm stop representing EFSA for a second, I would never ask it as well. We give the space for people to say whatever they want to tell us if it affects the work of the organization. But if they do not want to share because it doesn't affect the work, they don't have to share. So in my personal opinion, disabilities of any kind should never be asked in application process of any kind anyway. So this is EFSA.
Thank you very much. I remember Alejandra had a comment for when the speakers are over.
Yes, so I wanted to make a comment related to what Desireé was mentioning about the like more the training perspective, because so I had an experience with a person that this person is a trainer and they were a facilitator in an evaluation I was having with my team. And because of certain things that happened, I ended up the evaluation like crying and in a really bad state. And the facilitator basically didn't took anything that was happening into account. And this person simply assumed what was happening without having any idea. So it's more like, it's kind of a comment, but also maybe a question just to put up, like, seeing that situation, it makes me really reflect on trainers need to be aware of these things, because if something like this happens in a training or session that you are facilitating, you cannot just assume that the person is crying or feeling bad because the thing that just happened in this very moment or whatever is going into your mind. There is something else behind it. So I don't know if in other organizations there is this kind of training or awareness or something like that. Yeah, that's it.
Thank you, Alejandra. Does anyone else have a comment about this? Laura and Diana, do you have your hands up from before? Yes. Okay. So we have another question on the chat from Julian, but I will read it because his microphone is shaking. So we all know that being a board member of a youth association, local or European level, can be very draining and stressful, especially when you have a small board, or even when you're not in the board but a volunteer in other positions in the organization. Is this because we are putting too much burden on ourselves and taking on too much work? Why are we allowing ourselves to become overworked? And how should we tackle this? Johan?
Well, first of all, like Nick said way earlier already, it's if you're motivated for or enthusiastic for voluntary work or this thing you're volunteering for, it is easy to get into this. I work because I love it so much, and I want to do something for it because I'm passionate about it. So I would say that is one thing. And the other thing that I realized now while mentoring new trainers is that it's way easier to take care of others and tell them, okay, take a break. Or like, your goals are way too high, let's talk about them. While doing it for myself, I'm very bad at that. So the things I tell my mentees and try to help them in having a successful trainer's path while still enjoying training is not the things that I tell myself. So I believe what is always good is mentoring or supervision or intervision in some form. So people look for yourself, because you cannot always see everything from yourself. You need sometimes an external opinion or an external eye to tell you, okay, maybe what you're doing right now is not as good as you think it is, just from what I observe. And then you can get into the conversation, and during that you might realize, okay, this person is right. I should not deliver 100 hours in the next 2 weeks, because this is way too much and I cannot do this. So I think this is how I would tackle it, with more implementing of more mentorship or supervision.
Thank you. Antonis?
I'm going to break it in 2 parts. Both are small. In one of our big events in BEST, we had a talk from one of our alumni regarding the size of things and how big or small things seem right now, and how we create a huge image of something that in some years will look so small and so unimportant at the time. And if you put that in retrospect, and at this moment you understand how big or small you want that thing you're doing to be, then your way of coping with that, your coping mechanism will change. If you think that this is okay, something that it doesn't matter if I mess up, then you're gonna treat it more lightly. You're gonna be fine. You're gonna be fine, really. And that's one part, how big we see things. The other part is, if you as a person are doing and are discussing about other things than your organization while being in your organization. Because there have been occasions where I've told other people, or other people have told me, okay, let's stop for a minute. Let's not talk about BEST for the rest of the day. Tell me, what else are you doing? And that could do 2 things. Either you relax and you get reminded of other things that you're doing in life, and you find some distance from all the tasks that could be stressing you at the moment, or you suddenly realize, okay, maybe I put way too much effort in this the past few days, and I need to take some time off, and I need to do all those things that I'm talking about right now. I need to go and take a run. I need to read a book. I need to do all those things, and this will enhance that need and will invite you to do those things. So I think those 2 are really important.
Thank you. Diana?
Yeah, thank you. So something that we always do in a new team, whenever we form it, be it team, working group, board, is that we make a social contract based on how are we going to behave inside of this team. So everyone puts specific expectations forward and makes it clear to the other members on how we are going to behave inside of a team. And you form a small community that is supposed to work and understand those rules. For us, that has also worked quite well in managing expectations, which is quite important in the team, so that you're free to say, I cannot do this, or I'm not free to do this. If you already have things like that implemented, it's also much easier for you to do that. Because what I've also very much noticed is that sometimes people are very much afraid of saying no, because they feel like they're going to be shamed, or like they're going to fail someone. But if you put this kind of initiatives forward, you create from the start a better environment for you to be able to say no. So having in general expectation management sessions at the start of anything is always good, so that people can learn more about each other's working styles, that they can learn more about, for example, when are you not going to be free? If you say, I'm having exams throughout the entire February, I cannot do anything, then you can prioritize your work around that, and other people are aware of it. Additionally, there are so many tools and methods nowadays that teach you about how to prioritize your time and how to prioritize your tasks. Eisenhower matrix, Moscow method, they do work, and someone in the board taking responsibility of introducing that for the team works quite well. The third, I would say, having team buildings. This is one of the very important things for any team. If you have like a year-long mandate in the board, having it at least once per semester is mandatory, I think, for you to be actually be able to step out of your position and be a human in front of your team members. What we implement also are reflection sessions. Every 3 months, we have a reflection session where we go through basically what did we achieve, what are we satisfied with, what are we dissatisfied with, what are our plans for the future. I think that it also helps to put things into perspective, because sometimes you work for a year and you feel like you haven't achieved anything because you don't ever reflect on it. But if you do, you're going to see that you have so many small successes that you disregard after a year of not thinking about them. So this is also quite important. And something we have been discussing, haven't implemented yet, so I cannot speak of it, but we have been discussing about having board members, having either coaches or mentors, at least throughout the first few months of their mandate. So that you have someone there who is going to support you, at least in the beginning, until you learn about what it is to be a youth leader and a leader of a youth organization. So this is something that we have been thinking about. We have heard some others have been doing it already, so we might try it out in the future as well.
Thank you very much for the input. And Mariana?
Yes, thank you. I was going to mention several things that were already mentioned by some of the other speakers, but I want to especially echo what Tayana from ESN said. I'm realizing that we have very, very similar working styles. Yeah, it was very, very cool to see that. Also, some of the things that we have implemented within our team is that we put a very, very big focus on team building, and we do team building activities literally in every monthly meeting. All the regional team knows that when we finish the serious stuff, we will have some kind of activity to just loosen up and just as if we were staying a few more minutes after a regular meeting, just chatting or just doing something more fun, and so that we can still feel the human part of our work, and it's not just only work and decision making and so on. And I also, since I don't want to repeat everything that was said, I just want to remark one thing that I believe that is causing a lot of burden in this aspect, is the fact that right now, because of the situation that we're living in, our office for our volunteering staff, our office for our studies, and our living space is 100% the same space, and that is very difficult for us to distinguish when we should stop working in one thing, start studying, start relaxing. It makes it way more difficult to try to put these very necessary limits. And if they were already very difficult to set when we didn't have COVID around and we weren't forced to be inside, right now it's way more difficult. And I believe that is let's say a risk factor to overburden us with more work and try to also distract ourselves from what is happening, and the fact that you cannot go to a restaurant and just have a coffee with your friends. So yeah.
Thank you, Mariana, and thank you everyone for answering all these questions today. I'm afraid that we are already ahead of time, so we have to close this panel discussion. So I just want to comment that we have a workshop in half an hour from Frisse Gedachtes, focused on mental health. Okay. Yep, next slide. Frisse Gedachtes, we had Thomas earlier, is this organization that provides with support to students, and they will provide us with a workshop in half an hour, as I said before. So the link is the same one, and the room will be open for the first 30 participants. So we really hope to see you there. And thank you very much again for being here with us, and thank you to all the speakers for sharing all this interesting information. And see you in less than half an hour.
Thank you for letting us share. Have fun.
Thank you.
Thank
Bye.
you.
Thank you. Bye.
Bye.
Thank you. Bye-bye.
Thank you for coming.
Thank you for
Bye,
coming.
everyone.
Bye.
Be the same.
Bye.